finally discussing some data on boosters and the regimen with boosters, especially for patients with cancer. So patients with cancer may be offered vaccination as long as the components of the vaccination are not contraindicated. As we discussed, patients undergoing treatment may be offered vaccination as long as, again, any components of the vaccine are not contraindicated. Strategies such as providing vaccine in between cycles of therapy and after appropriate waiting periods for patients, especially as we discussed again in stem cell transplants and those with immunoglobulin treatments, can be used to reduce the risk. Cancer survivors definitely should be offered vaccination against COVID-19. And in terms of the recommendations for boosters, so the CDC provided draft guidance, especially for patients who were labeled as immunocompromised, which would fall, for most of the patients with cancer, would fall under that category, recommending an additional primary dose of vaccines for patients who are moderately or severely immunocompromised is recommended, and this additional primary dose is supplemental to and would precede the booster dose that is recommended for everyone who received primary vaccination, regardless of their immune status. And so here I just have a kind of schematic discussing the same. So for patients who have received the Moderna dose 1 and dose 2 and dose 3, then essentially would get a booster dose and then in at least 4 months get a second booster dose. Similarly, for patients who received the Pfizer-BioNTech vaccine, received the primary series, would be recommended to have a booster dose 4 and then at least 4 months have another booster dose 5. For the J&J, after the primary vaccine series, there would be additional recommendation of 2 boosters. So essentially, every patient with cancer should have a primary series and most likely 2 boosters at this point. And why are we recommending that additional boosters? And I think there is good amount of data now coming out that it does increase the response or serological response, as we say, which is basically the number of antibodies in the blood against the COVID-19 that can be found. And so here is a recent paper actually describing and summarizing rather the responses and the efficacy. So if we focus on the BNT162b2, which is the Pfizer-BioNTech vaccine, after the primary series, the efficacy of primary series is only 62 to 72% in patients with cancer, compared to, as we discussed before, 95% for most patients who are not immunocompromised. And then when they receive boosters in 2 to 4 months or within 6 months, essentially there is an increase in the serological response, which has been demonstrated by numerous studies. And similarly, we can see for Moderna, the efficacy of the primary series was about 85% compared to the 95% for most non-immunocompromised individuals. And again, when we are talking about giving boosters, we see that there is increase in serological response. So I think at this time, it is pretty clear from the CDC guidance, as well as some of the data that's coming out in terms of the response from the boosters, that every patient with cancer should receive a primary series, as well as get 1 booster and then an additional booster. So a total of 2 boosters is recommended at this time. Thank you so much for your attention, and if you have any questions, please feel free to reach out to me on my contact information here. Thank you, and I hope you enjoyed the talk.